My name is Dr. Karen Flannery. I am physician board certified in internal medicine, hospital medicine, and addiction medicine. I've been practicing for nearly 20 years in South Florida, West Palm Beach, and have developed a team of providers that focuses on concierge recovery and wellness services. We kind of developed this out of necessity. I started out in this area working in a sort of a high-end concierge hospital-based detox unit in West Palm Beach, and realized that patients kind of self-selected, came into this unit because it was detox only, because it's high discretion, high level of discretion. They come in under an alias, and but mostly they self-selected because they only intended to kind of hit the pause button, seek out detox, feel better, clear their head for a few days, and had really no intention of going on for further treatment. And so, I realized a couple of years into this that it takes a village, and I felt that if I developed a team to meet them where they are, literally and figuratively. They, when they're in the detox unit, everybody on the team comes to meet them, from the recovery coaches to the psychotherapists. Lots of wellness endeavors, guided meditation, mindfulness training, and lots of functional training. We feel that physical activity is a big part of it. Nature exposure, re-exposure for people who've really isolated, and began kind of bringing this to them even while they're still in the early detox phase. Then we found that after they go home, if we follow them and have that continuity into their home, again, meeting them where they are, seeing them in their actual home environment rather than them traveling back and forth to a treatment center, I think accomplishes several things. One is seeing sort of how they behave in their environment, what is activating or triggering for them in their home environment, the relationships, the support or lack thereof that they have in their own environment, and also really understanding the challenges that they have in coming to bring themselves into a social or group environment. And so it may not be the last stop for them, and many folks that probably would benefit from going to an intensive residential treatment center perhaps will get there at some point, but we at least start the process by trying to work with them closely in their own home environment.
And we've recently been able to work a case together, so I see how comprehensive and what care you deliver, and I'm really grateful to have been able to be part of that. I would imagine that most of these clients are in that higher net worth, just by the fact of, but, I think this is something that's not often addressed. When we're in counseling education and master's program, we often talk about cultural diversity, and often we're dividing that by race and sex and religion. And I definitely believe that this is another population that has some specific issues. And I think generally in the world, nobody wants to feel bad for someone that has a lot of money and they have their own set of issues. What are some of the challenges around this type of treatment, maybe before you come in, that you see with this group of people? And do you agree with what I'm saying there?
Thank you for asking that question. I absolutely agree. And I think I've seen it kind of in two ends of the spectrum with the same population. It's funny that you say that, we don't want to sort of feel sorry for, someone who has lots of money, but money, I've learned, is not happiness. However, with wealth seems to come a sense of power, a perception of power, whether it comes from within or other people perceive them as sort of being at this higher level. And so what I see in two areas is either those who are really still feeling kind of the president of the universe, I like to say, I control everything, everyone reports to me, I'm ultimately responsible, and so they feel the weight of the world on their shoulders or they're always in the limelight, and so everything has to be to their expectation, and therefore they hold themselves to extremely high standards. Anything less than top notch is perceived as failure by them and those who hold them in that regard. So that's sort of one end of the spectrum. The other end I see are those who, I guess you'd say, at least perceive that they have slid, fallen down, and they may still enjoy or retain the wealth that they've had, but they feel powerless at this point. Not so much when we're talking about substance abuse as being powerless over their addiction, but rather they've lost their sort of their position and their lair, their comfort level, and so being able to find sort of their new approach in life. Maybe they don't need to run the company anymore. Maybe they, I work with a bit of an older population too, in that, a lot of these are able to retire, at an earlier age, and, they thrived on being able to work, 60, 75, 80 hours a week, and then they were so great at what they did, and they built their empire. It kind of runs itself, or they've done well in getting the people under them to run it, and then they feel a little displaced, and so there's a dissonance, cognitive dissonance between, sort of the profits keep rolling in, but suddenly they're not as needed, or they sort of lose the tendency to kind of take out all of their energy, in the work environment, and then maybe they turn to other things, or perhaps even start to isolate, which then opens the door to, all kinds of other emotional and substance use disorders.
Oh, that's really great. Thank you for sharing that. And from what I understand, you had you had your medical training and were practiced in a certain way for a period of time, and then went into addiction medicine. What, if any, were some of the bigger awarenesses, or maybe kind of thoughts that you'd had that kind of were challenged or changed when you moved into addiction medicine? Maybe what you thought about addiction before, as you learned about it, and then also started working with that population. Is that a fair question?
Yes.
Okay.
Give that some thought. Well, I mean, the huge thing, and I'm grateful that it's talked about now, but the stigma, associated with addiction, and the compassion, even among healthcare providers, and I guess, I was in a high acuity and high volume environment, and so there's a certain level of burnout, sort of people that work, in that environment in healthcare. But then you see the people around you that start to become a little callous, a little jaded, a little judgmental, and I said, wow, the people who are suffering the most, who are really hurting, it may seem that they're coming in for emergency, as a hospital medicine physician for many years, coming in for emergency medical services with various, chest pain or GI illnesses or things that, someone who's basically looks at them and says, you know what, we ran all the tests, you're fine, there's nothing wrong with you. You're anxious, you're depressed, you're med seeking, it's related to substance use disorders, and perhaps somewhat dismissive. And I think not to necessarily fault the healthcare providers, but it really highlights the need for education for everyone on the healthcare team, not just those that are working in the addictions field or mental health field, but rather sort of a sensitivity, an awareness, and I think this might be one of your future questions, but I'll just tell you one of the things that I've found most gratifying, and I guess I was surprised to find this. The work that I'm doing now, it's a very low volume, high touch practice. As a concierge level physician, I get intimately involved with each patient, and I think, the patient, I'll tell you, the patient that we were working on together recently, he heard what I do, and he told the referent, he was afraid I was going to come in and label him right off the bat as an addict, and to judge him as, he told me he's, been told multiple times, all of your medical conditions or complaints are psychosomatic, and so that I might judge him and just say, I too would say he's crazy, or this is all made up, it's all in his head, and I was glad that he sort of gave me that opportunity to realize that that is the fear that a lot of folks live under, that they're being judged, that they're being accused of, either overutilizing healthcare services, or they're really just stuck in a healthcare system that maybe doesn't have the capacity, the education, the training, and the services to show them the kind of compassion that they absolutely need. And so if there's one thing that I try to do and that brings me the most joy in my line of work is to just be compassionate, to try to empathize, and right off the bat to say, yeah, there probably is a component of this that is psychological or emotional, but that is a chronic, ongoing health condition the same way as, something that's medical and based out in your organ systems would be. The brain is just one more organ. So how about we talk about the interplay between the brain and the body and how those things come to play?
I'm so glad you said this. I there are a lot of things that we see, especially when we're dealing with things like post-traumatic stress disorder and other stress disorders or anxiety that are psychosomatic. But that doesn't, I mean, I think the feeling is that, or the belief is often, if it's psychosomatic, it's not real. It's still real. It doesn't matter if it was caused by my environment or breathing some air or, that was polluted, or a system that I grew up in that created a belief that formed this kind of experience in my body. It's still real,
Yes, yes.
and we have to treat it.
To validate it first.
Validate it first, and then not just say that's something that we can push away. I mean, and it's obvious to me in just the short time that we've had dealings together how compassionate and connected you are with them, and seeing that person we were working with really develop that trust and be able to see, because probably was in some ways everything you would look at it, it would be like med seeking or something else, but that's relief seeking too.
Sure.
And so where would you like to see the medical community as a whole, like in early trainings, like when they're entering medical school? What would you like to see change? And I know some of it has, but what would you like to see most change related to addiction services or mental health services or education about them?
Thank you. I think starting probably far earlier than those who choose to go into health professions, starting at an elementary, or at least like literally a high school level, to work at educating, informing, creating safety around talking about mental illness and substance abuse. And I have my daughter's a sophomore in high school, and they've implemented a mental health training into the curriculum now. It became mandatory this semester, and it's evoked a whole range of responses. But right off the bat, what I've noticed is it creates a culture of safety, and it gives everyone permission to talk about how they feel when they're exposed to, say, a peer who is faced with mental illness challenges. The other thing I wanted to point out, and this is, I guess for a long time this was kind of almost like embarrassing for me. I remember it was very early on in medical, when I was in medical school, my first year, and we were talking about something psychology and just sort of introductory stuff. And I remember I raised my hand and I said, I really think that there's a lot of subclinical psychological conditions out there. And for those who don't necessarily understand subclinical, things that don't rise to meet sort of the diagnostic criteria of depression or anxiety or PTSD, but have features of them, or people have those feelings, even though they may not, their behavior may not be fulminant. And so when I said that, I don't know if I asked for a show of hands, but I guess I was just almost expecting everyone in my med school class to say, yeah, you're right. We're all a little, challenged in our own ways. And like nobody had my back. And I was like, okay, so maybe I won't talk about that again for a while. And it took me a long time to say, you know what? No, there is a lot of subclinical emotional dysregulation, psychological sort of early stage conditions that if that's when we can assess and show compassion, empathize, and potentially intervene, I think we'd have a whole lot less substance use disorders, fulminant mental health disorders, the opioid epidemic, gun violence, road rage, name it, because we could really support each other and create a culture of safety where we're all free to talk about that and heal together.
Well, thank you so much. It's been so great to talk to you today, and we're really grateful you are here.